Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
High blood pressure, also known as hypertension, is a serious medical condition that can bring on a cascade of negative health effects, including heart failure and stroke. It's often called a silent disease because many that have the condition don't even know it. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Sarah Medley, your host. Stay tuned. Welcome back. Joining me today is Dr. Sharon Hecker, a cardiologist and fellow of the American College of Cardiology. Dr. Hecker was featured on our Heart Hints and The Real Cost of Fast Food shows. Thank you for joining us again, Dr. Hecker.
Thank you, it's my pleasure.
It's great to have you here. So today we're going to be talking about hypertension. Can you tell us, what is it?
Yeah, hypertension is another word for high blood pressure. So it's when the pressure in the blood vessels of our body, predominantly the arteries, is higher than it ought to be.
So why is hypertension or high blood pressure called a silent killer?
Yeah, well, the increased pressure puts a lot of stress on our blood vessels. And the blood vessels, as you know, supply our whole bodies, our brain, our kidneys, our heart. So if those organs are under increased stress, it leads to a long-term wear and tear on the body.
So who's most likely to develop high blood pressure?
Well, there are a lot of risk factors for high blood pressure. Obesity is a risk factor. Sleep apnea, if you snore excessively, is a risk factor. But one of the really unfortunate things is as we age, all of us, our blood pressure slowly creeps up with each year that we live. Now, you would think this is a natural process, that our blood pressure rises as we age, but unfortunately we found that even though it is natural, it's not necessarily good for us. And intervening on this increase in blood pressure actually saves lives and prevents illness.
So what about the difference between men and women in hypertension?
Yeah, there's a little bit of a difference. Women tend to get heart disease a little bit later than men do. Additionally, women after menopause have a bit of an acceleration in their increase in blood pressure. But really, when you look at the whole population, it affects men and women equally and in just as severe ways, really.
So what about race or ethnicities? Are there differences there?
Yes, certain races are more likely to have high blood pressure and more likely to have ill effects from the high blood pressure. In fact, some races or genetic backgrounds don't do as well with certain of our traditional blood pressure medicines and need others. And an example would be African Americans. Mm-hmm. They have a tendency to develop high blood pressure at an earlier age and to require a little bit different treatment.
So how does someone know that they have it?
If you know that you have it, it's probably pretty severe. Usually the only way that you find out you have high blood pressure is when you go to the doctor's office or down to, say, Walgreens or Walmart and check your blood pressure and start to notice that it's on the high side. And by high side, I mean over 140 over 90. So any numbers either on the top or the bottom that are over that would be considered high blood pressure. Ideally, your blood pressure should be closer to 120 over 80.
So can you talk to us and the viewers about those blood pressure levels a little bit more? Help us understand that.
Okay, so the top number is the systolic blood pressure. That's the blood pressure that your blood vessels experience when your heart contracts. The bottom number is the diastolic blood pressure, and that's the blood pressure that your blood vessels experience when your heart is relaxing. The numbers are millimeters of mercury, so that's an atmospheric pressure that we gauge it against. And again, 120 over 80 is what's considered to be normal. It can be as high as 140/90 before we absolutely have to treat it, although certain disease states like diabetes warrant a lower blood pressure. And sometimes some patients, if they are very old or maybe have Parkinson's disease or some other problems, we might let the blood pressure run a little bit higher because the patients will feel better at the higher blood pressure.
So how often should a person take their blood pressure or have their blood pressure checked?
That's a really good question. If you have high blood pressure, you should have it checked more frequently, maybe once every week or two, to make sure that your blood pressure is within the range where your doctor would like to see it. For a person who's not yet been diagnosed with high blood pressure, probably just screening blood pressures when you go to the doctor or when you go again to maybe a health fair are reasonable. But once you start noticing that your blood pressure is on the high side, you might want to check it more frequently.
And then I'm assuming once you know you have high blood pressure, then you need to start thinking about different ways of controlling it. And I'm assuming I hear about salt in a diet. So can you talk to us maybe just about salt?
Yeah, that's correct. Decreasing the salt in your diet to, again, less than about 2,000 milligrams per day can have an impact on your blood pressure. I also like to tell people that there is a diet called the DASH diet, which is the dietary approach to stop hypertension. It's basically a low salt diet, but it's also high in calcium and potassium, high in fruits and vegetables, low in simple carbohydrates, and that by itself can help to lower the blood pressure as well as one of our medications. Another thing I would like to add is that just losing 5 to 10 pounds, just by losing the weight, will lower your blood pressure. So if you're frustrated, and you're like, I don't want to start this medicine, just losing a little bit of weight would really help.
Good information. Thank you. So we're going to pause now and take a quick break. Stay tuned to learn what types of conditions and negative health outcomes high blood pressure can cause. We'll be right back.